Hi, my name is Caitlin Fink. I'm the coordinator of the Livingston County Community Alliance. Today I'll be talking about the current and national trends of youth marijuana use and abuse. This presentation is brought to you by MCOSA and the Chippewa Valley Youth Coalition. We will be utilizing the Mobilizing Michigan Protecting Our Kids from Marijuana campaign. The campaign goals provide research-based information on the negative consequences of youth marijuana use and provide factual data on the negative effects on youth and communities of the legalization of recreational marijuana in other states. So first, we're going to talk about marijuana use in youth with the data. This slide presents the 2015 Monitoring the Future data. It shows that marijuana is the most highly abused illicit drug and that alcohol is still the #1 drug used by youth in the region. Monitoring the Future is a national survey that gathers data on trends of illegal and legal drug use by teens and adults in the U.S., as well as on related issues. Monitoring the Future is conducted by researchers at the Institute for Social Research, U of M, and is funded by the National Institute of Substance Abuse and the National Institute of Health. This survey reflects over 40,000 youth. As you can see, alcohol use is still the #1 drug of choice abused by 12th graders, and marijuana follows closely at second. Data presented with the permission of SAM, Smart Approaches to Marijuana, a national advocacy group. This slide provides past 30-day use data nationally and in Washington State and Colorado, where recreational marijuana has been legalized. The graph shows that the use in Washington State and Colorado is substantially higher than national use across all age ranges, including youth. The data suggests that legalization increases youth use, likely because of the increased access and the normalization of use. So let's take a look at the risk versus 30-day and past year use, the national data. 35% of 12th graders reported using marijuana at least once in the 12 months prior to taking the 2015 Monitoring the Future survey. Marijuana, the most widely illicit drug, did not show any significant change in annual prevalence in 2014 for any of the grades 7th, 9th, and 12th graders surveyed. Daily or near daily marijuana use, defined as smoking marijuana on 20 or more occasions in the past 30 days, is not shown on the graph. However, 6% of 12th graders, 1 in every 16 or 17 high school seniors, surveyed reporting smoking marijuana daily or near daily. According to Dr. Lloyd Johnston, lead investigator for Monitoring the Future, the proportion of our young people smoking marijuana this frequently remains a matter of concern. He notes that the percent of students who see regular marijuana use as carrying a great risk of harm has declined substantially since about 2005 and is still declining. Perceived risk is usually a deterrent to use, and it is clear that this deterrent has weakened considerably. All right, so now we're talking about why should we be concerned about our kids? Well, the research tells us that marijuana use, particularly by youth, has the potential for significant negative consequences. The levels of THC, the element of marijuana that produces the high, has increased dramatically in potency over the decades. So this is not your mama's marijuana. The director of the National Institute on Drug Abuse, Dr. Nora Volkow, says it's much more potent marijuana, which may explain why we've seen a dramatic increase in admission to emergency rooms and treatment programs for marijuana. So the teen brain is a work in process. A doctor from the National Institute on Drug Abuse says, this study suggests that even light to moderate recreational marijuana use can cause changes in brain anatomy. As you can see from the slide, a healthy brain of a 16-year-old regions appear active. With youth marijuana use, the brain of a regular marijuana user spots an inadequate lack of brain activity. A 25-year study of over 1,000 participants, funded by the National Institute on Drug Abuse, a federal agency, found that regular use of marijuana during the teen years can have a detrimental effect on IQ. The study found that those that heavily used marijuana prior to age 18 years could lose up to 8 IQ points, a substantial loss in cognitive functioning. Further, those in the study that were heavy marijuana users during the teen years showed deficits as adults in several cognitive areas, including memory. Studies have found that pre-adolescent marijuana users who eliminated or reduced their intake may not restore IQ points. Effect of cannabis on the brain could result in poor academic performance and school dropout, which might produce further declines in brain functioning. Contrary to common belief, marijuana can be addictive. Research suggests that 30% of users may develop some degree of problem use, which can lead to dependence and, in severe cases, takes the form of addiction. People who begin using marijuana before age 18 are up to 4 to 7 times more likely than adults to develop problem use. We should also point out that marijuana use that begins in adolescence increases the risk they will become addicted to the drug. The risk of addiction goes from about 1 in 11 overall to about 1 in 6 for those who start using in their teens, and even higher among daily smokers. Here is a fact. Each year, more teens enter treatment with a primary diagnosis of marijuana dependence than all other illicit drugs combined. A teenage marijuana user is 2 times more likely to drop out of school than a non-user. Marijuana and driving is also a bad combination. Marijuana can slow reaction time, impair judgment of time and distance, and decrease motor coordinations. A lot of the times we hear from kids with the juvenile court that kids will feel better using marijuana and then driving instead of alcohol use and then driving. So we really need to raise awareness like we did with drunk driving into marijuana use and driving. Scientists need to conduct more research to know how much of a drug impairs a person's driving ability. But even small amounts of some drugs can have a measurable effect. Some states have zero tolerance laws for drug driving. Michigan is still in limbo, and the jury is out on that. Legislation now is passing through, making it illegal to drive under the influence of any drug. However, with the unclear laws that are currently in place, we do not know what that limit is. Almost 20% of teens who drink and drive say alcohol improves their driving, and 34% say the same about marijuana. Several studies have linked marijuana use to increased risks for psychiatric disorders, including psychosis, which is schizophrenia, depression, anxiety, and substance use disorder. But whether and to what extent it actually causes these conditions is not always easy to determine. The amount of drug use, the age of first use, and genetic vulnerability have all been shown to influence this relationship. The strongest evidence to date concerns links between marijuana use and substance use disorders, and between marijuana use and psychiatric disorders, and those with pre-existing genetic or other vulnerability. So now we will go into the effects of legalization of recreational marijuana in other states. States like Colorado and Washington that voted in November 2012 to allow marijuana to be used for recreational purposes are finding challenges and unintended consequences. Like big tobacco, marijuana could become big business, but at what cost to our kids and our communities? Investors have already raised $50 million to launch Marley Natural and other branded marijuana businesses. But the political campaigns to legalize marijuana does not mention branded marijuana products such as candy or advertising practices. One of the things that we hear a lot that a tax on marijuana will cover education costs and costs of the roads. This is untrue. In the U.S., in 2007, illegal drugs cost $193 billion in healthcare, lost productivity, crime, and other expenditures. Optimistic evaluations of the potential financial savings from legalization and taxation are often flawed and fail to account for the considerable economic and social costs of drug use and its consequences. This issue is particularly relative in the marijuana debate. Another recent report examines this issue in greater detail. The report concludes that legalization and taxation of marijuana would lead to a decrease in the retail price of the drug, likely by more than 80%. While this conclusion is subject to a number of uncertainties, including the effect of legalization on production costs and price, and the federal government's response to the state's legalization of a substance that would remain illegal under federal law, it's fair to say that the price of marijuana would drop significantly. And because drug use is sensitive to price, especially among young people, higher prices help keep use rates relatively low. So for every dollar gained from alcohol and tobacco revenues, $10 is lost in legal, health, social, and regulatory costs. How will this be different for marijuana? Livingston County businesses were surveyed in 2015 to better understand the local drug policies and drug testing in the workplace. It revealed 55% of businesses feel legalization of recreational marijuana use in Michigan would negatively affect the company's ability to hire and retain employees. 87% of businesses believe if employees are under the influence of marijuana, it negatively affects safety in the workplace. Also, 67% of businesses report marijuana is the drug of choice for applicants who test positive on pre-employment drug screens. So with marijuana and advertising targeting children, can we trust companies and big corporations not to target youth and the vulnerable? How trustworthy have they proven in the past? Again, using the tobacco industry mascot, Joe Camel, and marijuana industry mascot, Buddy. So also, marijuana edibles are a public risk. Edibles often contain 3 to 20 times the THC concentration recommended for intoxication. There's been at least 3 deaths in Colorado related to marijuana edibles through 2015. Another side effect of marijuana edibles also poses risks to family pets like dogs and cats. They see it as a potential snack food and unfortunately digest marijuana. Many THC products appeal to children. These include marijuana infused with gummy bears, soda pop, sucker, Pop-Tarts, and ring pots. There was a 40% increase in drug-related suspensions and expulsions in Colorado from school year 2008 and 2009 to school year 2013 and 2014. Teen arrests for marijuana use at school in Denver, Colorado is also increasing. Teens arrested for marijuana use at school increased by 6%, comparing the 2012-2013 school year and 2013-2014 school year. From 2011, when medical marijuana was legalized in Colorado, through 2013, there was a 57% increase in marijuana-related emergency room visits. Hospitalizations related to marijuana have increased 82% from 2008 to 2013, when recreational marijuana was legalized. Marijuana significantly impairs judgment, motor coordination, and reaction time, and studies have found a direct relationship between blood THC concentration and impaired driving ability. Marijuana is the illicit drug most frequently found in the blood of drivers who have been involved in accidents, including fatal ones. 2 large European studies found that drivers with THC in their blood were roughly twice as likely for a fatal accident than drivers who had not used drugs or alcohol. However, the role played by marijuana in accidents is often unclear because it can remain detectable in body fluids for days or even weeks after intoxication, and because users frequently combined it with alcohol. Accident-involved drivers with THC in their blood, particularly higher levels, are 3 to 7 times more likely to be responsible for the accident than drivers who had not used drugs or alcohol. The risk associated with marijuana in combination with alcohol appears to be greater than that for either drug by itself. As we can see from the chart, only a small amount of cities tax the marijuana that is sold. So again, that kind of plays into the thought that an increased tax on marijuana will raise a lot of money. So legalizing any drug makes it more available to teens. Legalization also promotes the idea that the drug is safe for teens to use. And if you think about it, this is the same as prescription drugs. A lot of teens think that prescription drugs are safe to use because they're legal, and if a doctor tells you it's okay, then it must be safe. The same goes for legalization of marijuana and marijuana use. How do we educate others about the dangers of marijuana for our youth and communities? We want to repeat the messages regarding healthy youth as many times and places as possible. Repeat your messages regarding healthy youth as many times and places as possible, because the more times people hear a message regarding the dangers of marijuana to youth, the more likely they are to question information promoting its use. So remember, keep your messages simple, base your messages on scientific facts, and provide consistent messages. A special thanks goes out to the Chippewa Valley Coalition and the Macomb County Community Mental Health Office of Substance Abuse for providing this information and presentation. You can get additional information from the Mobilizing Michigan website available at cvccoalition.org and MCOSA.net.